Straight ahead here now is Virginia Democratic Senator Mark Warner. We also have Tennessee Republican Senator Bob Corker. Gentlemen, thank you ever so much. Mr. Warner, first time on the Kudlow Report. We appreciate it very much. We've been trying to get you for a long time. I want to ask you, sir, in view of
I can be with my friend Bob Corker, I'm happy to be on.
All right, well, that's great. Maybe we can use him to lure you on more frequently. I like the sound of that very much, sir. Perhaps you heard what Senator Bayh and Senator Gregg had to say. They're both concerned about America's fiscal condition, the budget impact of these proposals. Senator Warner, can you expand the uninsured by a volume of whatever, 40 to 50 million has been promised, and still cut costs and lower the budget deficit?
Well, I've actually put together a letter with 9 other freshman Democrats urging Senator Baucus to raise up in his proposal, and we haven't had a chance to study it all yet, the cost containment issues, and recognize that that's got to be absolutely equally important to coverage. Let's face it, right now we spend $2.5 trillion a year on health care, more than any other country by a factor of 2 in terms of per capita. We can bring down some of these costs, but what we're going to have to focus on is how we change the financial incentives, and none of the legislation I've seen so far moves far enough in that direction. We've got to really move away from the whole fee-for-service where we compensate docs, hospitals, pharmaceutical companies based on their volume and really pay more on the basis of the outcomes. That's going to take a radical reworking of the whole financial incentives, and so far the legislation has not seen that. So I echo a little bit of both what Senator Gregg and Senator Bayh had said, that driving down costs has got to be a higher priority than I've seen so far in what the proposals laid out.
Senator Corker, Mr. Warner says there are not enough financial incentives to hold down costs, and I'd like to add to that, Mr. Corker, is there enough real, honest, patient consumer competition and free market choice in this bill? Some people think free markets are the way to hold down costs.
No, as a matter of fact, one of the concerns would be that, look, I think we ought to create exchanges and competition, but the way it's being laid out in the Senate Finance Committee, it almost turns insurance companies into utilities. And one of the reasons I like being on your show, Larry, other than your charming personality and intelligence, of course, is your astute audience. And I don't know how many members of your audience could go to a bank and in essence show 10 years worth of revenues and 7 years worth of cost and be able to finance that. Well, that's exactly what is happening in this Senate finance bill. So we're creating something that's going to add to huge deficits. As a matter of fact, if you looked out to year 11, it just begins to wedge out in such ways that if taxpayers saw this and citizens saw this, and I think you'll make them see it, it's really alarming. So I think we really do need to look at this in an incremental way. There are problems, issues of pre-existing conditions. I'd love to see cross-state line competition, to have more robust competition as you just have outlined. But we need to push the reset button, do this incrementally, be as physicians are when we come see them, do no harm. And I really think with smart people like Mark Warner and others who you've had on your program, we could do something that will stand the test of time. But where we are today does not do that.
Senator Warner, let's just follow up on Mr. Corker's idea, interstate insurance competition to keep down costs and give better choices to individuals. In the excerpts to Mr. Obama's speech, I don't see any mention of that. What is your take on interstate insurance competition?
Listen, I think that ought to be part of the mix. We've got to make sure there's more competition. And this whole debate about options and what kind of incentives we put to have additional competition, we got to make sure that there is more of a free market in healthcare. We don't have that right now. But one thing where I think actually Bob and I will probably also agree is that the option of doing nothing is also a financial disaster. If you look at those same budget deficit projections, what is driving our deficit more than anything is growth of Medicare and Medicaid. If we do nothing, average families are going to see their insurance premiums double over the next 10 years. If we do nothing, we're not going to be able to have American business truly remain competitive in a global economy, because American business pays about $3,000 more per employee than any of our competitors in the rest of the world, based on healthcare costs. So, there may not be a perfect solution out there right now, but the notion that we can simply kick the can and ignore the need to take on healthcare reform would also be a financial disaster.
Well, Mr. Corker, in the light of Mr. Warner's worries about the entitlement programs, particularly Medicare and Medicaid, would the government have been better off tackling the Medicare deficit, which some have estimated to be as much as $40 trillion over the coming decades?
There you go with one of those astute questions again. The fact is, that we're talking the Finance Committee is looking at taking $410 billion out of Medicare to leverage a whole new entitlement. The trustees have just said that Medicare is insolvent in the year 2017. The fact is that just to make sure physicians and nurses are paid the same in 10 years as they are today would take $285 billion. But they're not going to deal with that. So that's exactly what we need to be doing, Larry. And thank you for letting me be on again today.
Well, you're terrific to come on. Mr. Warner, last one I want to add. Can you live with a government insurance option?
Listen, a government insurance option that doesn't change the financial incentives isn't going to get the job done. You need more competition, but what we've got to do is not only push down the financial incentives and get them aligned right in Medicare and Medicaid, but in private insurance as well. If we can't find some savings in $2.5 trillion, then candidly, we all ought to be fired because we're spending way too much and not getting the quality outcomes that we deserve.
All right, that's a strong statement. Mr. Corker, do you think that Mr. Obama will let the insurance option, the government option, go? Do you think he'll let it go, or do you think he's going to insist on it tonight?
I think he's going to let it go. I really do. But I tell you what, it's been feeling much like a whipsaw up here over the last 2 days, and I think that they're gauging the public. My sense is he'll drop it, but he may get feisty. He was that way in front of the labor unions Monday. Who knows what's going to happen? We're all going to see in just about an hour.
Senator Warner, welcome again to the Kudlow Report. Senator Corker, again, thank you for coming back on the show. We appreciate it, gentlemen.